today marks exactly 2 years since the WHO declared COVID as a pandemic. And as long as there is interaction between humans and wildlife, zoonotic viruses will seep into our lives. We've seen that with COVID, Zika, Nipah, Casanur forest disease. So if I may begin with you, how do we enable continuous learning in higher education institutions in a post-pandemic future?
Good afternoon to all the dignitaries and the participants from various social life. Participating in the Deccan Era at Bengaluru 2040 Summit. So with regard to the pursuing the higher education in the post-COVID, how things go on in a higher education institution. Even during the COVID, we were able to have classes on and off. Somehow we were able to manage it very effectively, though there were a lot of challenges, learning challenges, but we were able to accomplish the regular schedule of calendar of events with bit delay. But to go forward, probably this is also a golden opportunity to bring in the technology integration into the higher education. Probably in this direction, we were very successful to entirely digitalize the higher education system and administration also on the technology platform. We have brought in the Unified University College Management System, wherein all the transactions will be captured and seen two-way within a matter of seconds. It has done a huge transformation. Probably we are happy and proud to say that we are the best in the country, wherein we have brought the learning management system, smart classrooms, device to the students. We are providing device to all the students who are pursuing degree education, and engineering and polytechnic institution we are providing who are studying in the government institution. And more so with regard to the Unified University College Management System to connect all the stakeholders. So it is very effective and it will ensure that the things will happen very effectively in the administration, in the governance, as well as academically, digital evaluation, digital services, digitally enabled admissions. By doing all these things, we ensured that education has been given the topmost priority and the use of the technology has really changed, and you'll believe it or not, probably we'll measure and we'll inform all the stakeholders, probably the quality of education will increase by 10 times. 10 times, it will be more than 10 times the quality of education will improvise in the state of Karnataka, and implementation of national education policy also, which has happened in the 21. That's really a transforming initiative which will lead to much sustainable development across all the sectors, and which will lead to a lot of reforms, decentralization, giving the autonomy to all the institutions to take up the responsibility, not only power, it will be more of a responsibility to ensure that the best possible quality, which is second to none, will be provided to our children from the state of Karnataka. And Karnataka, we want to emerge as a destination for education.
So you're saying that e-learning will be the new normal in a post-pandemic future. Learning management systems and providing laptops or tablets to students, that is how you aim to bridge this digital divide that is there in the country. But if it is a polytechnic, engineering, or a degree student who is economically or socially disadvantaged, seamless internet connection and 24 hours electricity will be very essential for him to attend a smart classroom. So how do you intend to ensure this in a...
We have taken care of all this aspect. We have provided Wi-Fi in each and every government institution. Wi-Fi has been provided. There's a battery backup to ensure there's a 24/7 power supply. All these aspects, whatever needs to be, there's no loose ends here. We have ensured whatever we have done, it is very perfect in a very good, best possible system is in place. We are assured and ensure that nothing goes wrong here. With all the experience, we have been doing better.
Thank you for that, sir. Dr. Balal, we've seen hospitals being slammed with patients You have had your workforce working in rotations when they themselves fell sick. We had a riveting keynote address by Dr. Shetty where he said, we will have a future where people who are not required to be in hospitals won't be there in hospitals anymore. So how do you envision hospitals in, let's say, 2040, when COVID is endemic and, you no longer need a government order to say what to do or how to operate?
Honorable Minister for Higher Education, Dr. Ashwathnarayan, Director of our prestigious institute, NIMHANS, Dr. Pratima Murthy, Senior Leadership of Deccan Health, distinguished leaders, ladies and gentlemen. I'd like to thank Deccan Health at the outset for hosting this event, which is, I believe, a very important event to design our future in every aspect of our lives, including healthcare and education, as the Honorable Minister did mention. So COVID is something that we cannot forget. In my 50 years of medicine, I started my medical career in the 70s as a student, I have never seen anything like this. I have seen various pandemics, including smallpox. Smallpox, AIDS, Zika, H1N1, all kinds of viruses that are known to mankind, but none have completely turned our world upside down. This has truly been a black swan event that we may not witness for another 100 years. So this certainly has changed a lot in the way we deal with healthcare for the future. First and foremost, I think healthcare has been given the importance it deserves. We are only as strong as our healthcare system is. I think that's a very, very important message for the future, which means we have to invest heavily in healthcare so that we're able to face such pandemics in the future. The second thing is that I think one of the very important aspects which I find was lacking was civic responsibility. The disease spread like wildfire because we did not have the civic responsibility of masking, distancing, getting tested, going to the healthcare when it's required. So I think no pandemic can ever be won anywhere in the world without people's cooperation and participation. That's what we are seeing in the Western world. I mean, there are anti-vaxxers, there are anti-maskers, and everything that can help the coronavirus smile and spread like wildfire. And that is something that we have learned. The third thing is I think we have to move away from treating illness to creating wellness. I think wellness is the mantra, and even being a doctor, maybe it's not good for our business, I think our aim should be to keep people out of hospitals. We should treat them at home, outpatients, daycare, but reserve the inpatients only for the critically ill and people who have to undergo procedures. And this is possible with modern technology. I think technology has helped us. Now with the watch, you can measure your heart rate, your oxygen saturation, your blood pressure, your temperature, everything that the doctor measures in the hospital in a matter of minutes, and it's real time. Your doctor can have access to it. So I think home monitoring, remote monitoring, and appropriate treatment based on that would be the norm in the future. So also major leap in diagnostics. When COVID came in, we hardly had any labs that could do RT-PCR for COVID. Now we have hundreds of labs doing millions of tests of RT-PCR, genomic analysis, so on and so forth. And that's wonderful that has happened. The next thing is, of course, digital health. A huge boost for digital health. I still remember we were in a quagmire of a myriad of regulatory, legal issues, and you couldn't do a video consult without the threat of possibly going to jail because you're doing something illegal. And all that changed in the third week or the fourth week of March 2020. Within a matter of 3 to 5 days, digital health became the norm, and I think that was a huge boon during the COVID pandemic for remote care. And also it bridged the gap between the cities and the rural India in many ways. Very, very important aspect, and I would like to congratulate the government of Karnataka, is a huge boost for public-private partnership. I must congratulate the government of Karnataka because right from the first day of pandemic, they called for meeting of all the private hospitals, which is rarely done in the government sector, because we live in silos, but the government of Karnataka invited all of us. And right from day one, we were participating in the care of COVID care. And I think for the first time in the country, a novel project was started by the health department of the government of Karnataka, a private-public partnership between the government and the experts from the private sector, which sort of virtually ran all the district headquarters hospitals of Karnataka. And believe it or not, with just one measure of digitally connecting the experts in Bangalore to the various hospitals in Karnataka, where hundreds of thousands of patients were seen over many months, the mortality was dropped by 50%. One more of our aspiration for the future is universal health coverage for everyone. The Honorable Prime Minister has started Ayushman Bharat. We need to extend that. And also, we should not forget the missing middle who do not have any kind of insurance. So if all these things are taken into place, I think we are ready not only for 2040, maybe even for 2060. But we should learn from history, not repeat the mistakes, and look to the future. Thank you very much.
Thank you, sir. Dr. Murthy, 4 days after the first national lockdown was imposed, NIMHANS was getting tons of calls from across India about anxiety, stress, and depression. I think so far you have done more than 6 lakh consultations. But in a post-pandemic future, it cannot be the only one hand-holding everyone. So how can these systems that have already been built, the capacity building that has already happened, how can this be leveraged in the future?
Thank you very much, and greetings to the panelists and ladies and gentlemen. 2040 is only 20 years away. So it's not really too distant in the future. And there have been both developments and problems that we face that we've been unable to address in the last several decades. So I think we need to be clear that we need to be tangible in our planning. So I'm going to speak as, to answer your questions as the director of NIMHANS, as a psychiatrist, as a woman, and perhaps as a citizen of Bangalore and the country. So one of the things that we've realized is that even if the COVID pandemic is more or less over or behind us, world over, it's perceived that there will be a global mental health pandemic. And the reasons for this is not just that there have been stresses, and there have been huge stresses for people during the pandemic, from anxieties about getting infected, infections, loss of family, etc. But subsequently, there have been other issues like employment, education, migration, all of which are known to be predictors of mental distress. As you said, we've had more than 6 lakh calls during the pandemic of people not just wanting information, but also seeking, problems about children, problems about elderly. There was an increase in domestic violence. So many things like that have come to the fore. So I think it's very important that we have systems, as you said, to address this. And I think COVID, one of the biggest lessons that COVID has taught us is the use of technology, number one, is the use of a hub and spoke model, the command centers, and reaching out to various people. And if we can actually use that effectively in healthcare, I think we can reach a lot of care to people. One example is mental health. So there is, as you're aware, an announcement by the Government of India about a tele-mental health service, which hopefully will reach the underserved parts of the country and will enable everybody to reach some form of mental health care, reduce distress, look at wellness. We have the health and wellness centers. If we link it up to that, we can look at wellness, addressing psychological distress, stress, and of course, serious mental illness. There is equally a treatment gap for neurological and neurosurgical disorders. So for example, we were just talking before this discussion about the number of people that come for acute care to NIMHANS. This morning, I had a person come from Gulbarga, all the way from Gulbarga to NIMHANS. Look at the amount of the person has to spend, the loss of the wages, and the fact that everybody need not come to tertiary care centers. So having good hub and spoke models, and we've actually proposed this to the government of Karnataka because we've got a lot of infrastructure that has developed during COVID. So many of the hospitals have good equipment, have good ventilators, have good beds. If we don't use that effectively, we will actually, they will not come to ruin. And therefore, I think this is a great opportunity to make sure that this kind of acute care is decentralized in different parts of our city. People are trained. Now, there is no alternative for human resources. You need human resources, whether it's at the end of a telephone, whether it's an ICU, whether it's to tell people how they are. Technology can assist us, but we also need to develop this. And if we develop both together, I think there is a great scope. Then, of course, as a citizen, I would look for, we were talking in the morning, Mr. Sood was talking about safety. I think safety, is very, very important as a citizen to make sure that my mental health care is good. And also, we know that the ecology is very important for mental health. So cities are not the happiest places for people to be. So we need to make a conscious effort to make sure that cities are not just smart, they're not technologically driven also, but all the kind of basic needs and the social needs of people are met. Exercise, diet, safe social spaces, looking at substance use reduction, suicide reduction, all of these are very important aspects.
Thank you, ma'am. Dr. Narayan, both of them made an important point of the importance of partnerships, be it public-private partnerships or otherwise. So in the future, if we were to be struck with something of this magnitude, how can we in higher education institutions ensure that students do not experience the same kind of anxiety, the same kind of fear that they had of experiencing learning gaps, learning outcomes?
With regard to this, sensitization and awareness is the most important thing. So in the national education policy, probably the health and wellness has become mandatory, believe it or not. Now each and every student, he can learn, he can gain a lot of knowledge, but he should know how to take care of himself. That is a basic thing. So we have made sure that in the syllabus, in the very beginning, in the very first year, all of them need to learn about health and wellness. And probably by doing this, we ensure, because this is a very common challenge. Very common challenge. People don't know many a times from what they're suffering. Most of the time, they don't think they are willing to accept what kind of symptoms or problems, whatever they have been facing, psychologically, physically, whatever it might be. But they normally don't tend to accept that, and they don't reach out to any of the medical professionals. So we are trying to create that kind of awareness among the college students in all the institutions, probably digital literacy, health and wellness, and financial literacy, and fitness activity has been given the topmost priority, and it has been made mandatory. And the right engagement of the students is very important. Probably the real transformation and sensitization of all aspects, even the law. Many of the youngsters don't know what are most of the serious laws, what are the implications. So we're trying to sensitize the basic aspects and ensure that each and every youngster will be more responsibility and aware of the issues, whatever we have been facing in the society. We're enabling, and probably as Dr. Balal and Dr. Pratima, what they mentioned, there are huge challenges with regard to the psychological aspect. We have huge shortage of resourceful manpower. Probably to cater to this kind of demand is really challenging, but by creating a right awareness, group counseling, career counseling, this can really address many of these challenges, which we are doing in our education program.
As a follow-up question, have there been any assessments made in the kind of gaps we've had in learning outcomes in higher education institutions?
Definitely, there's a lot of learning gaps are there. So we are trying to address all these learning gaps. Probably in the present national education policy, the very basic intention and aim is to address the learning gaps. It needs to be comprehensive, it needs to be holistic, and it needs to ensure that each and every person, whoever gets into higher education, should get employed. He should be employable, industry ready. There is no question of compromising, and we are trying to, connect with the industry. Where are the opportunities? What kind of requirement? What kind of skill gaps are required? And the assessment starts from the day one only. We are trying to create a platform within probably next 3 months. It will be up and running, and each and every student can, access that platform and get assessed. What are the skill gaps he is having? How it needs to be addressed? And Government of Karnataka, we are trying to provide whatever is the skill gap support system, skill training, or through knowledge, through all aspects. We are ensuring nothing goes wrong for each and every youngster. We are guaranteeing that a better future, all of them should become employable, and we have come out with a very bold statement, job for all. Sarvarigu Udyogano anta ondu uddeshadinda we have done it, and we are trying to ensure all the challenges, whatever, because now we are working very closely with the industry. The entire industry now is part of our education academic activity. We have got the NASCOM on the platform. Now we are providing STEM as well as non-STEM student. Even the non-STEM student, we are providing the future skills. We are tied up with Infosys Springboard. There they are providing 1,200 add-on programs. The topmost users among the 11 lakh users are from the Government College of Karnataka. Top 10, among the top 10, top 7 are from government institution, first grade degree colleges. This is how we have created microsites, and we are working with many more industries, and we are working very closely to ensure there's no gap. And internships, mandatory internships are there. Earlier, the internships in engineering, it used to be only for 4 weeks. Now it will be there for 36 weeks. Not only just having internship, it will be a paid internship. Paid internship, projects, apprenticeship, everything has been very well assured, and we are completely revamped the entire curriculum, and it is industry friendly in consultation with industry. Taking all stakeholders into confidence, we have been working. There's a huge opportunity. Karnataka has become the land of opportunity and land of future, and with the education, not just education, quality education, with all combination of skill and holistic personality. We are emphasizing and ensuring each and every student will be getting this kind of facility and the training.
Thank you, sir. Dr. Badal, in the morning there was an interesting point made about how robots can do all the redundant work in hospitals, like measuring temperature or BP. You don't have to have people do that. So how viable is this in a futuristic, vision that you can have for hospitals?
Certainly, I think, certainly in the future, we'll be using more of technology than human beings to do most of the work. And robot is just one such technology. Of course, it doesn't necessarily have to be a robot the way we see the one that's running around greeting children and all that. Even your watch or your cell phone does a lot of things that the robot can do. As I said, one of the main things when you come to a hospital is checking your vital signs, which is your BP, heart rate, respiratory rate, temperature, maybe oxygen saturation. All that can be done even without a robot. So robots will be used for many things, including, of course, interacting with people like what children now do in malls and other places. They can talk to the patients, get the history, and we can use these health kiosks with robots in it, which can look into your eye and transmit that image to the doctor. They can look into your mouth, see your tongue, look at your fingernails, all that a doctor would do. So I think it all depends on how expensive or how inexpensive the robots will be, whether it is easier to hire a robot rather than hire a human being, not at the cost of losing jobs. And that also depends on how commonly you use it. When the cell phone first came, I remember I was in the US, I had a big bag, which was my cell phone for the car, and cost thousands of dollars. But now the cell phone cannot be seen. So it's so commonly used, even the fisherwoman, the maid, everyone has a cell phone. So I'm sure as technology advances and also becomes less expensive, we will be replacing many of the human functions with robots.
Dr. Murthy.
Just to interrupt the discussion that's happening, but I do believe Mr. Ashwathnarayan has a meeting to be part of. So you will be kindly excused, sir. Thank you so very much. Before we let you off stage, though, I would quickly like to invite Mr. Sitaraman Shankar to do us the honors and felicitate Dr. C N Ashwathnarayan for being part of this panel discussion as the conversations and the discussions continue. A quick photo opportunity with Dr. C N Ashwathnarayan for being part of our wonderful discussion. Thank you so very much.
Ma'am, so I was about to ask you, you mentioned the National Tele-Mental Health Program, and what is essential in that is training of people in the 23 centers of excellence that are part of the network. So in 18 years, in 2040, how ready will these institutions be vis-a-vis NIMHANS?
Okay, let me just quickly, add a couple of things to what the Honorable Minister said. I was just in a meeting with the UGC, and they're planning to introduce credit courses for undergraduates in health and wellness as well as illness. So I think the whole idea is to make everybody more responsive from a very young age to how you can do practical things. How can you do CPR, for example, or how can you, if there's a bleeding, how can you stop it? From that to how do you handle stress, how do you handle various tensions, pressures of, education and work and so on. The second thing that Dr. Balal mentioned, you talked about robotics. People are looking at robotic arms to do high precision surgery, for example, in neurosurgical procedures. So, the opportunities are huge, but I think the costs are what we need to bring down and to make sure that these are available equitably to everyone. You talked about the mental health network. So the whole idea is that we can train people again. We don't need to rely on, high-end specialists. Young people can be trained to assess people who need services, to give them some little bit of counseling, and then to escalate people who need services. And that's the most important thing. It's not just about telephone counseling, but making sure that you connect people when they need to go to specialists or to services which can immediately attend to them. So in some ways, you reduce the time it takes for a person to actually reach the services and only escalate those who need to go to those services so that everything is efficiently used. One important thing this will take care of is stigma. Whatever it is, however educated we are, there is still a lot of stigma around seeking help for mental health care. And I think one of the things that we need to do is be able to talk about mental health just like any other non-communicable disorder. And if we reach there, I think we'll be doing a lot of, reaching good. The other thing is to integrate physical and mental health. And I think that is what COVID has actually taught us to do. Not to look at, things in silos, but to look at the whole thing together. We know that they're very closely interlinked. A lot of people with NCDs, whether it's cancer, diabetes, hypertension, have a lot of mental health distress which they never address. And that worsens their physical health outcome. Similarly, people with mental disorders, their blood pressures, their immunity, those can reduce. And that can also lead to problems. Substance use disorders. There's a very nice article in Nature Communications where they've looked at moderate drinking, for example, and what it does to the gray and white matter. Lots of people don't know that. So I think in terms of educating people, these can be very important in terms of awareness, in terms of basic counseling. Many of us are hugely stressed. We're otherwise okay, sometimes very stressed. So these kind of facilities can help us to deal with it. And most importantly, the Prime Minister mentioned mental health promotion. We have a lot of ways in which we can support each other, learn techniques to make ourselves more resilient. And especially in urban cities, we have to learn to be resilient, and come together as a group to address all the basic and higher needs that we need to get together.
Thank you. Dr. Balal, one example of infrastructure being beefed up during the pandemic is one of oxygen infrastructure, where all hospitals, be it government or private, beefed up their oxygen infrastructure. But a point they made is that, what do we do with it after COVID? We do not have that kind of oxygen requirement. So in future, if we were to have further waves or further pandemics or epidemics, how do we see to it that this investment does not go to waste?
I get your point that we have invested a lot on infrastructure which we may not necessarily use. It's like the army having the reserve force. We don't use it on a day-to-day basis, but if there's a war, you'll call every one of them to fight for the country. So also we cannot let go of the reserves we have because we don't know when the next zoonotic illness will show up. There may be another pandemic, a cousin of corona, an uncle of corona or something that comes up in the future. So the infrastructure we built should remain with us. Just to give you an example, the second wave of corona was brutal. I mean, never in the history of mankind have we seen so many deaths, so much of morbidity and mortality, and every ICU was full, no oxygenated beds, no oxygen, and all kinds of things happened. So we were much better prepared for the third wave. We had thousands of beds, maybe hundreds of thousands of oxygenated beds, but there are no patients. So we kept it vacant, but that brings a smile in me because it was good that we didn't have patients, but we would have been able to manage if there was the same kind of wave that happened in the second wave. So I think this should not be taken as a waste of resources. I think it should be taken as an insurance and a protection to be used when it's needed.
Ma'am, I think you have an applause from the audience for that. Ma'am, you mentioned that a lot of things can be done remotely through telemedicine networks, etc. This e-Manas portal that the government is investing in, how much of it is really being used? Are all mental health providers really registered in the state on the e-Manas portal? Are their rights being assured with this portal?
So I think the most important thing to understand is that there is a Mental Health Care Act, which has mandates for people who are not able to have capacity, and therefore their rights need to be taken care of, number one. The second thing is to make sure that people move across the system. And that is what the e-Manas actually is intended to do. It's to actually document what the entry of persons into the system, and to make sure that there is an easy movement across these, and to make sure that whatever it is in terms of mental health review boards, all these things are carefully documented. That is the purpose of the e-Manas. So I think it is one little step in this whole process of getting proper networks of care developed, especially for people who cannot reach services well in time. So I see that as one aspect of this large operational network that needs to be developed. I wanted two of my pet things to talk about is this hub and spoke model for acute trauma and stroke. So I want to emphasize that in our city now, as Dr. Ballal said, there is a lot of infrastructure that has been developed, and we need to use it well. Our public hospitals are actually wonderful places now where we can put in this acute care so that hospitals like NIMHANS don't get congested, people don't have to wait long periods of time, get disappointed, and we would be willing to handhold these centers to provide them the necessary training. You've also spoken about the Brain Health Initiative, which is really about increasing public awareness about neurological disorders. Again, a huge treatment gap there. And therefore, headache, stroke, what are the risk factors? How can people make sure they look after their health so that their risk reduces? Exercise, stress, everything together. And then make sure that these are recognized early so that there's no complications of these disorders. And of course, many of them need rehabilitation. So if we really have a continuum of healthcare, then I'm sure so many citizens would be benefited from such interventions.
Dr. Ballal, as an expert nephrologist, you saw what the pandemic did to organ donations. We did not have that much time to prepare. The donations went down drastically and patients were left in the lurch. So what can we do to prepare for a future where donations drop, but patients are not affected that much?
Kidney donations,
yes.
You mean? Yeah. I think the people who are the most affected, or at least some of the most affected people are people with kidney disease, either on dialysis or awaiting a transplantation. As you're aware, dialysis is done 3 times a week. They have to travel quite literally miles together to get into the dialysis unit. And during the first wave and the second wave, lockdown, transportation issues, so on and so forth were huge. And many a time, I must thank the police for this. They have actually helped us transport patients back and forth. Of course, transplant was an entirely different ball game. Transplants came to a standstill. 0% transplants done for a few months during the first and second waves. Because one is you don't want to give medicines which suppress your immunity in the middle of a viral pandemic. So transplants were literally stopped. Second thing is, of course, many patients who had already had a transplant became very sick because of the immunocompromised state. So now we are seeing a lot of backlog being done, but unfortunately a few people have died waiting for the transplant or unable to get into dialysis. Hopefully that's behind us, and we look forward to a better future in the sense we have a better awareness and control of pandemics in the future. And one of the main things we should do is that we should make sure that non-COVID or non-pandemic care doesn't get affected in the middle of a pandemic. That was a huge, huge burden. The center stage was COVID. It didn't allow any other actor or actresses to be taken care of. So we had patients dying of heart attacks, cancer, kidney failure, stroke, so on and so forth, because they could neither come to the hospital for fear or lack of beds, and also transportation issues. I think hospitals of the future should be designed so that we can simultaneously take care of any epidemic illness or a pandemic illness, and also non-pandemic care.
Thank you, sir. Dr. Murthy, can you comment on robust functioning of mental health review boards? Because during a pandemic, what happens is the normal functioning of these boards are in suspended animation, and there is nowhere patients can go for grievance redressal. So can you talk about mental health review?
I think we are actually supporting a mental health review board at NIMHANS now, because obviously there needs to be some modern infrastructure for people to meet and so on. But once again, I think that's where digital technology can come in handy. We were listening to how even, the courts have now turned to, digital methods, online hearings in the court. So MHRBs can actually do a lot of their work on a digital platform. But we need to make sure that they meet regularly, that they evaluate. I mean, MHRB is not a new concept. Hospitals had visitors boards in the past, which would look at the needs of patients. So similarly, if these meet regularly, do online consultations, I think they can be very good. But I just wanted to emphasize on mental health and wellness, and that's where I just remembered the Deccan Herald was possibly one of the initial organizations that actually took up employee mental health and well-being in a big way. So I think more and more organizations need to do that so that people can be helped early and problems can be, curbed in the early phases.
All credit to our management in that regard. I'm afraid we're completely out of time. Thank you so much for joining us on this panel today. Thank you, sir.
Thank you so very much, Suraksha, for bringing us the best from the panelists, of course. Now I'd like to invite on stage CEO of TPML and editor of Deccan Herald, Mr. Sitaraman Shankar, to felicitate our panelists, Dr. Sudarshan Ballal, Chairman of Manipal Hospitals, as well as Dr. Pratima Murthy, Director, NIMHANS. Thank you for this really noteworthy discussion with plenty of points that came about. Lots of footnotes as well. Really appreciate the time that you spent with us. Dr. C N Ashwathnarayan as well. Thank you so very much.